What was the biggest mindset gap or challenge when you first set out to do this, and how have things evolved in these 10 years?
So 10 years is quite a journey. So when we first started, and as expected, I think the biggest barrier was silence, because it was usually stigmatized, which one already knew. It was a big taboo topic, and silence remained the biggest barrier to, it was a big mindset barrier. And when I say silence, I mean in the sense that one could not talk about it. One was not even there was silence also from the fact of understanding what is really happening. And so, that obviously then came in the way of accessing mental health care, that came in the way of even just sharing the load. And that in itself was very isolating as well, right? So, and silence even came in the way of people actually accepting any kind of mental health workshops. When we first approached schools or colleges or, corporates, people were not willing to take on a workshop with the fear that if they take a workshop on, it means that there is a mental health, problem, crisis in that organization, and therefore they shirked away from it.
Right.
So silence in itself became a big entry to barrier and a big, big deterrent.
They didn't want to acknowledge it or endorse it in any way.
Yeah.
I don't think people were used to seeing it as a preventative solution or just a essential solution for mental health and, regular hygiene in that sense. What were the conversations like at the time? How did you broach these subjects, and how did you finally get to start seeing people changing their view?
So I thought it's best to take the bull by its horn. And we just, when we even approached, say, schools for workshops or say corporates, we, straight away spoke about mental health. And that's when I realized that there was a huge gap in even awareness. So there was a whole lot of people who didn't even know what was mental health. So we had to actually backtrack and start from that. So we first started actually talking about mental health and having mental health literacy, awareness.
Sure.
Because, like, say, for example, in the Hindi language, there is no word, no singular word that talks about anxiety, that says anxiety.
Really?
Or depression. So we had to really backtrack, and we saw even in rural communities, people were not even aware of what they were experiencing. They knew that they were feeling low, tired, so on and so forth. But there was no idea, there was no awareness or concept that it could be a mental health concern. And for that matter, even in our urban settings, multiple times when we've worked with different communities, when we started with the mental health literacy workshops and sensitization camps, is when they realized that probably what they themselves are going through is something called anxiety or is depression. Till then, it was just burnout, fatigue, demotivated. One never understood that there could actually be a physiological or a chemical reason to it.
So what are the early signs, let's say, of burnout, fatigue, or do you feel that more than that, anxiety and depression, that's really where the biggest problem is when it comes to what our population here faces?
Anxiety and depression definitely are quite high up on the radar, and there could be various reasons for it. And one would normally see it with burnout or fatigue, irritability, just generally feeling demotivated.
So those are the symptoms.
Lack of interest in activities that otherwise would be of interest to you.
Do you feel as an ecosystem that people are now, or families are now trying to work at finding solutions to manage some of this impact? There's so much being talked about, but I don't know how much of it is actually happening on ground.
Yeah, no, definitely. I think when we first started out, it was really just talking about mental health, right? And just creating awareness, like I'm saying. But I think now people are asking for systems and structure and, programs on how to embed mental health, counseling or mental health programs or mental health awareness. So I think definitely that has shifted. And I think even as families, just simple thing like even, when we started out, I would never get calls from anybody. But now, over the last, say, 5 years, I do get people calling in, asking for help, or just asking that, somebody in the family, somebody in the ecosystem is going through an issue, asking for suggestions. So, people are definitely open to it. People are definitely wanting to seek help, are wanting support. Even in institutions and organizations, people are wanting to set up systems. So at least from, talking about what is mental health to how do we embed it in our system.
If you like the video, do like, comment, share and subscribe.